How many of you have had an injury only to have the problem reoccur? You know, that one thing that just won't go away and it stays the same. For instance, chronic low back pain, running injuries, knee pain, iliotibial band strain syndrome, Achilles tendinosis, in the upper extremity, shoulder problems, headaches, neck stiffness. Why do these problems continue to reoccur? On X-ray, there's nothing wrong, but the problem is still there. Often, these injuries are a result of repetitive strain and overuse that affects the soft tissue structures. To get full resolution, to get you back on the trail, to fix your low back pain, to get you back at work, and finally fix this problem, there's 3 areas that we need to address. The first is soft tissue health. The second, we need to implement corrective exercises to prevent muscular imbalances. And the third, we need to improve your biomechanics. The soft tissue, there's a few ways that can be damaged. The first is an acute injury. For instance, if you roll your ankle, the body will respond to this with inflammation, and the inflammation will cause adhesions and scar tissue to protect the joint from further damage. The other way is an accumulation of microtrauma. For instance, repetitive strain, overuse, you're running, you're swimming, lifting weights, doing the same motions over and over. This can cause micro tears, and the body respond to this with adhesions and scar tissue that prevents the muscles from sliding back and forth. Right? And this can create a hypoxic situation as well, where the area is not getting enough oxygen. In this picture, notice the muscles, right? And in between, in the red, these are cross-fiber adhesions. And this is a result of repetitive strain and overuse. And the muscles are not able to slide back and forth, and this is a soft tissue injury. And these are where most injuries are a result of. What happens with this is it can restrict motion, the muscles can become short and weak, alters mechanics, you can have a loss of strength, you have increased pain, and it can also cause a peripheral nerve entrapment. Soft tissue consists of muscles, ligaments, tendons, nerves, and fascia. Remember, muscles are designed to lengthen, shorten, and help stabilize. What makes this possible is the fascia. The fascia is a deep connective tissue that surrounds each muscle individually, yet at the same time connecting all the muscles together. Right? So muscles, they go back and forth, and they move without any hang-ups or restrictions. Often, the problem areas that won't go away need soft tissue treatment. Active release treatments is my primary technique, because it's designed to free up restrictive cross-fiber adhesions through active motion using my hands to manually release the bound up regions. Active motion is key. Once the soft tissue injury or condition has been addressed, this is a great time to incorporate corrective exercises. Muscles have a tendency to be overworked or underused depending on activity. For example, in the lower region, there's a term called the lower cross syndrome, which consists of tight hip flexors and tight back muscles, and also weak core and weak glutes. If you have back pain, hip pain, and running injuries, this lower cross syndrome needs to be addressed by utilizing corrective strategies. Same holds true for the upper extremity. There's a dominant posture adopted across the board. It's where the body is flexed over in a hunched position with a protruded neck, rounded and internally rotated shoulders. This reduces shoulder and thoracic mobility and causes shoulder pain, rotator cuff injuries. It's a common culprit for neck stiffness and headaches, and it causes poor scapular control. The third component, which is often not addressed, is to improve biomechanics. If you're doing a particular movement incorrect, whether running on a trail, in the pool, the weight room, or at work, this will continue to place stress to the area. Running injuries are rampant with runners. Key principle number 1, run from the core. Why? It protects the back, stabilizes the hip region, and prevents unnecessary and wasted movements. The action step, learn how to adopt a neutral pelvis. Why is this important? This is a setup point for keeping your body in alignment when you're running. Key principle number 2, release the brakes. Shoes provide a false sense of cushioning and allow us to land out in front of the body. This increases impact forces to the shins, knees, hips, and back, and is a common cause of running injuries. Action step to reduce impact forces to the leg. Learn how to land with your midfoot below your center of gravity. This is more of a natural way to run. To practice, shorten your stride and gradually land on your midfoot as it makes contact below your center of gravity. To practice this every week, just a few minutes without shoes, this will naturally shorten your stride and you'll land below your center of gravity. For a lasting solution to your long-term problem, to get you back doing what you care about, working hard, running, lifting weights, staying active, the 3 areas need to be addressed: soft tissue motion, corrective exercises, and improved biomechanics.